Hi, through this NCLEX RN type of video, we'll be seeing palliative care and end-of-life issues. Palliative care, it is a specialized form of care that focuses on the relief of pain and other symptoms and stress associated with a severe illness. Let's move to the questions. First one, hospice care is not appropriate in which of these circumstances? Let's see the options. The patient decides to forego curative treatment. The patient's prognosis is 3 to 6 months. The patient is undergoing experimental chemotherapy. The patient is receiving palliative chemotherapy. For answering this question, you need to know what is hospice care. Hospice care focuses on the care of patient with a terminal illness who has less than 6 months to live. So it comes under palliative care, and also the patient's life expectancy should not be more than 6 months. Also, during hospice care, one important thing is most of the patients, they will be deciding to stop the curative treatment. But there are some exceptions, like in pediatric patients, we are not going to forego the curative treatment. So for answer for this is the patient is undergoing experimental chemotherapy. In that case, hospice care is not needed. Regular care in the hospital or other settings are required. Second question, Mrs. Jose is receiving hospice care in the nursing home. During the assessment, the nurse observed the patient is unconscious and has wet, noisy respirations and cool, mottled extremities. The nurse understands which of the following actions are indicated. Select all that apply. When you are assessing the question, you know that the patient is in hospice care. That means there is not more than 6 months for the patient. Next, the nurse has done the assessment. She has observed the patient is unconscious. The patient has got wet, noisy respiration, so there is some problem with the breathing. Then the extremities are cool and mottled. Let's see the options. Notifying the patient's family, requesting an order for an anticholinergic medication, notifying the patient's provider, performing a sternal rub to assess the patient's response, performing a full systems assessment. If it is a hospice care or any other care, we need to notify the patient's family. So first option should be included. Second one, the patient is having wet and noisy respiration. So of course, if we are requesting for anticholinergic drugs, it is very good because it will be drying the secretions and it will be lessening the gurgles, the upper respiratory sounds. That will be reduced with anticholinergic medication. So second option is also correct answer. Then we need to notify the patient's healthcare provider. That is also important in hospice care. But sternal rub or full systems assessment are not required in this particular question. Third question, the nurse asked the patient and family members if they have any questions about the patient's diagnosis and plan of care. This is an example of which palliative care domain. PZ is palliative care. Here you need to understand what are the different domains of palliative care. Then only you will be able to answer the question. Let's see the options and answer for this one. Then I will explain the domains. Physical aspect of care, psychological and emotional aspect of care, ethical and legal aspect of care, structure and process of care. Here, the patient and family members, whether they have any questions on the diagnosis and plan, this is what the nurse is seeing. This comes under the structure and process of care. Let's see the different domains of palliative care. With this understanding, you will know which comes under what. There are mainly 8 domains in the palliative care. The first one is structure and process of care. As already explained with the last question, it includes the planning and care which the nurse provides to the patient. So that discussions with the patient and family member, the plans, that comes under the structure and process of care. Second one, the physical aspect of care. Here, the nurse will be seeing the assessment part, treatment part, and documentation of the symptoms of the physical symptoms of the patient. So that comes under the physical aspects. Third one, the psychological and psychiatric aspect of care. We have to see and assess and document the presence of any anxiety, depression, delirium. All the symptoms need to be managed timely and efficiently during palliative care. So the psychological part is also important in palliative care. The fourth domain is social aspect of care, including advanced care planning. When it is social, we need to assess the patient and family members' social networks, cultural, legal, financial concerns, what are the caregivers' abilities, and what are the coping skills. All this comes under the social aspect of care. Next is spiritual, religious and existential aspects of care, which also need to be considered when we are providing palliative care. Another important area or domain is the cultural aspect of care. Nurse will be providing care to patients with different cultures, so their culture needs to be considered when we are providing whatever care, whether it is palliative or any other care. Then the care of the imminently dying. Sometimes we have to care for the patient who will be dying immediately. There are different stages of dying. The acceptance during different stages will be different. So we have to provide, the team has to provide very meticulous care during all phases of dying. Next is ethical and legal aspects of care. When the nurse is caring for a patient, she has to consider the ethical and legal aspect. Even in palliative care, that area is very important. The ethical principle of beneficence is demonstrated by providing care that benefits the patient, such as good symptom management, and also the patient's spiritual distress or should be addressed, and we should respect the wishes of the patient. We should not create any harm to the patient. So there we are considering the ethical aspect of non-malafeasance, and we need to provide equitable care to anyone who is coming to the palliative care. So that is an example of the principle of justice. So the ethical and legal things are also a part of the palliative care. So these are the 8 main domains of palliative care. Next, the nurse understands the moral distress may result in which of the following. Select all that apply. So when a nurse is caring for a palliative care patient especially, at that time mostly the nurse may feel some distress. She may feel ignored and she may feel like she's not respected as a professional. It happens. So how the nurse understands the moral distress? That's what this question is. Physical exhaustion, disagreement among staff, anger at family, anger at providers, feelings of undeserved power. When a nurse is moving through this moral distress, when the nurse is feeling that, of course, she will have physical exhaustion. She will feel tired. She will feel like not to do some work. Next, disagreement among staff. There will be arguments among staff. Of course, that shows some distress the nurse is having. Anger at family, the nurse will be showing. Anger at providers, the nurse will be showing. And the nurse will feel like she has lost her power of decision making of so and so. So all these 5 things shows that the nurse understands moral distress. This happens with the professionals. The nurse understands that appropriate action to take after a distressing discussion with a provider over end-of-life issues for a patient include which of the following. This comes under the moral distress. Okay, during moral distress, of course, there can be some arguments with the providers related to end of life issues. So at that time, what is the appropriate action the nurse has to take when disagreements happen? Avoid communicating with the provider except through the electronic medical record. Having a drink after work to calm frazzled nerves. Arguing with colleagues who disagree. Soliciting support from a nurse manager or ethics consultation. Here, avoiding communication, it should not happen. We have to communicate. Having a drink, it won't make much changes. Arguing with the colleagues also, it's not appropriate. But the last one, soliciting support from a nurse manager. The nurse need to ask support from her colleagues, especially from nurse manager when something distressing situation happens, and also ethical consultation should be done. Ethical committee, if you're approaching, how the model behaviors and respectful listening, how to encourage the dialogue, everything will be told, and it will be dealt in a very good way how the team members have to deal with. Hope you understood this video. Thank you. Please do subscribe for more videos.